Module 2, Previewing Questions. Does the board review the Community Health Needs Assessment and engage in setting community health priorities? Does the board review readmissions rates and know what efforts are being made to improve quality and overall health through strengthening transitions of care? Is the board actively involved in fostering community partnerships to advance health?
Boards are responsible, of course, for championing the mission and vision and the values of an organization, and being sure that we're really accelerating the focus on prevention and well-being, and which is not the traditional work of hospitals. So I think it's important that organizations have a definition of population health, because we're still learning about what that means. Sort of special populations or clinically based populations that we want to try to impact their health. They may be people with high utilization, high needs. So there's a certain set of metrics that you want to pay attention to, readmission rates, for example, being really important. And then there's the kind of community health work, community health improvement work, where you might be doing that with public health or supportive housing partners. And so that's a different set of data. You've got to have a clear picture of what success looks like in both of those streams, and that really drives what you measure and what you pay attention to.
The move from our business being the business of taking care of individual sick people to now all of a sudden encouraging and supporting and fostering broader health and wellness for not only individuals but whole communities is huge. And how a board thinks about that is a huge shift because it is all about allocation of resources at the end of the day. So it's very challenging to figure out which resources and what proportion of resources you focus on sick care and what portion of your resources are focused on health and wellness.
We're well past the days of being just a place for people when they're sick or injured. We need to think more holistically about how we improve the overall health of the community, and that means going outside the traditional four walls of the hospital. And so first off, understanding what population health is, and then being able to assess where any given institution is on its journey for improving the overall population health is critically important to then setting plans and setting resources aside and really focusing on that goal of overall improvement.
The community needs assessment, even if the board assigns the intricate, detailed, in-the-weeds review of that assessment to a committee, the board definitely needs to have discussion around it because it drives everything. In population health, if you don't have any idea what the needs are of your community, how could you possibly align resources and develop strategies to address those needs?
So the community needs a health assessment. We look at that for the analytics and the data to see where the care gaps are and the things that we need to improve upon. And then that gets assessed at senior leadership, and then that gets baked into our strategic plan for the ongoing 3 years. So it's a critical tool that we use. I think the key component of the assessment is that you understand where your care gaps are. So you understand where you have to marshal additional resources, where you need additional service lines potentially. But that assessment really provides you the data and analytics to do that and understand where you are at that particular moment.
The review of the community health needs assessment is critical. It's really critical that they understand what's going on in their community. So the needs that are there, the community health needs assessment, which most are done really, really well by local health departments and a whole bunch of partners coming around the table to do the planning, it allows for hospitals, in particular their boards, to understand what are the pressing issues that our hospital is facing that we should be addressing inside of community. If I understand where a patient is coming from, it allows me to be able to treat them better, handle their issue better, and from a board perspective, it's really critical in that room to have those different voices around that table.
The health system is learning to be a convener of other agencies. Obviously, nobody has the resources to attack all the problems, so bringing all those resources that are out there together, being innovative, they're all core competencies that we need to start looking at. We're always looking for the voice of the community to understand what is going on, what their needs are. We understand we have a diverse population and the needs are diverse, so it's a constant theme to our board evaluation.
more and more you're seeing hospitals and health systems partnering, collaborating, coordinating, not only with other healthcare providers, but also with the people and organizations that influence those other determinants of health. But there's now a changing mindset because it's more like a jazz combo. I mean, you take the lead today, healthcare system, and tomorrow, guess what? I'm the United Way, I gotta take the lead on this one because we're all rowing in the same direction, you know? So now you play the supporting role. And to do that, to be able to be flexible and have the mindset that you can flip back and forth from being the leader and the supporter is a huge change for boards.
I think everybody now understands that 75% of a person's health span essentially is outside of our clinical operations. It's the social determinants. So when you talk about food scarcity, the opioid issue, housing, all those things are playing in. So, you know, those conversations are getting more frequent and they're getting more focused right now. We understand fully that 25% of what we do is responsible for somebody's health and the rest is those social determinants. So there's a major shift, and I don't believe it's just in our organization. I think it's in healthcare. They understand that outside of our four walls is really the most critical part of what we need to do now.
Today, we are piloting the ability to screen for 10 social determinants. And so what it's done is really change the whole dialogue from just the clinical aspects to not only kind of all the parts that impact people's lives and our role in that. So in some cases, we need to take a very active role. Some cases we support others, some we collaborate, some we refer. And it really has, really looked at people's total health and well-being. So much so that we're very interested in things that would have never thought a decade ago, whether it's housing or personal security or financial coaching or job creation and economic development. Those are some of the most important things we can do. So we've actually done a whole variety of very non-traditional things in order to try to impact people's lives outside of healthcare.
So I think part of it is knowing your community health needs assessment. It's listening to clinicians who are treating people who are coming in for their 10th readmission in the last month. It's listening to community partners who have been trying to serve people with some of the non-clinical needs. And then designing programs that can be sustainable, that can be perhaps in partnership with other folks because hospitals can't do it at all. Sometimes it's the hospital convening a conversation and identifies good work is already happening. So to be sure we're not duplicating services, but kind of raising the profile of the need for certain groups of people, particularly those who are more vulnerable in our community. Well, I think being a trustee today requires an enormous amount of constant learning and awareness building, really being clear about who are the partners in our community for us to do this work with. In which ways can we build some synergies with partners that we've not worked with? Housing, transportation, issues around food and nutrition, safe environments. So it's just thinking about who are those partners in the work of health. I think being a good listener, because oftentimes, I think unintentionally, hospitals haven't listened as well as they might to other people also caring for our most vulnerable populations, people with really high needs, people who come from a different background or life experience. And so when we enter these conversations with a sense of openness and being willing to be surprised and having our assumptions challenged, then I think we're much better partners.
But really getting boards to transition to that generative type conversations, asking the hard questions, the key questions. Where are we going to be 5, 10, 15 years out? How is the system going to change? So it's making sure that these boards are really asking those tough questions about the things that matter now, not the status quo. When we talk about social determinants, food scarcity, the opioid problem, fee for service, making sure that there's bundled payments, that there is accountability on quality. That's the direction. And I think that gets moved, I think that needle gets moved quicker if the board is more diligent about moving that needle. So, I would say that's really key and core right now.
Not only does the board need to look at and understand the community needs, they need to be the one responsible for monitoring our progress and addressing them. And now, how you do that? In our system, the way we do it, we use our balanced scorecard targets, which are targeted on moving the needle on those specific needs our community has. Our board has to be the one that approves those targets every year. Every year we ramp up the targets, we adjust and change them. Are we making progress? Are we not making progress? That's the board's work. They need to be aware of not just the needs, but they need to look at those targets of how you're going to move the needle to address the needs. That is really part of the guts of what the board does in population health.
You know, when the day is over, most of our mission statements talk about the health and well-being of our communities. We can make a significant impact. It really fits perfectly with the things that we're doing clinically. Caregivers will tell you they see these issues every day. We just have never provided the resources to do it. It's not like you have to create all the resources. Many times they exist in your community. You just need to touch the dots. And to start and to have some dialogue about what role should the healthcare organization be in.
Key takeaways. Boards must be educated about the social determinants of health present in their communities and understand how they impact health and quality. Hospital boards can be instrumental in developing and strengthening community partnerships. Boards can support efforts to employ next-generation strategies to improve both community and population health that will keep people healthy and out of the hospital, as well as improve quality outcomes.